The following is a demonstration of a healthcare provider meeting with a postpartum adult. This person is open to quitting tobacco. Notice how the healthcare provider applies the 5 A's: ask, advise, assess, assist, and arrange of tobacco cessation counseling.
I see on the survey that you stopped smoking during pregnancy, but you are smoking now.
Yes, and I am so upset about it. I
Yeah.
was so proud of myself for quitting smoking once I found out I was pregnant.
Yeah.
And then, I don't know, I guess I've just been stressed and exhausted lately, so I just gave it.
Yeah. I'm really glad you quit when you were pregnant too. And I do hear that you're disappointed you've gone back to smoking. You know, a new baby, it adds so much more stress and so much more, it takes so much energy out of you that we sometimes return to those old habits that we have. Quitting while pregnant was great for your health and for your baby's health. And now that your baby is here, we also want to make sure that you quit to make sure we're not exposing them to second or third hand smoke. It's also the best thing you can do for your health, which is really important.
Yes, I definitely don't want my baby or myself exposed to tobacco.
Yeah. Are you interested in trying to quit again?
Yes, I would love to. I just don't know where to start again.
Yeah. Well, this is something we can do together to make sure that you are successful this time. And you don't have to do it alone. I have a booklet here for you that's got some good information on quitting after a new baby. Tell me a little bit about what helped when you were pregnant.
Well, I switched up my routine. I got rid of all the tobacco products. I informed my friends and family that I needed their support because I was going to quit, because I was pregnant. And at first, and I also chose a quit date. But at first it was really hard. But it was really helpful to have the support from my friends, family, especially my boyfriend.
Yeah. And it sounds like stress is what's making it hard now to quit. What could help now? Is there anything you did while you were pregnant that could help now?
Well, honestly, I'm just not getting enough sleep every night.
Yeah.
Like, I'm trying to cook dinner every single night, take care of the baby, just trying to do everything.
Yeah, you have a lot of new responsibilities and a lot to juggle. And sleep is a really common thing that people struggle with after a new baby. I wonder, so you said that your boyfriend is living with you. I wonder if maybe he can help you take care of the baby to make sure you're getting at least 3 or 4 hours of sleep in a row where you're not being interrupted. And maybe he can help with some of the other things that you're handling.
Yeah, I would definitely love that.
Yeah.
Because he loves to cook, so he
Okay.
can definitely help out in that area.
Great. Something else I want to recommend that can really help is medications. You might have heard of the nicotine patch, gum, or lozenge. So those are really good options to help manage any cravings or urges, especially during really stressful times. I like for people to use them.
Well, I am breastfeeding. Can I still use them?
You can still use them while you're breastfeeding. The gum and lozenge get out of your system in about 90 minutes. So what a lot of people do is they breastfeed and then they'll put in a lozenge and use it right after. If that's not enough nicotine, we could add in a low-level nicotine patch. Whether you continue smoking or use some of this nicotine replacement, you can continue to breastfeed. The benefits of breastfeeding outweigh any risks of nicotine from cigarettes or this nicotine replacement.
Okay, good, because breastfeeding is very important to me.
Yeah, I hear that having a healthy baby and doing the right things are really important for you. One other thing I want to do today is connect you with the Quit Line. So they offer free coaching. They by telephone or text message 24/7, so you can connect with them anytime to help you quit smoking. So there'll be some extra support, some extra resources around you, and they are a totally free service. Would you like me to put in that referral?
Yes, definitely. I think having someone check up on me will help me stay motivated.
Great. So I'll put in that referral. They'll be reaching out to you, and we can check in on this in a couple of weeks when we meet again. You've quit before, and I know you can do it again.
All right, and hopefully everything works out.
I hope so.
Visit YouQuitTwoQuit.org for free resources for your practice, including training on evidence-based tobacco use screening and cessation counseling, technical assistance for implementing the 5As and 5Rs in your setting, as well as educational materials for healthcare and allied health professionals and patients. That's YouQuitTwoQuit.org.